Okay, so as you can tell, I broke my hand. Now here's an x-ray that I got the Saturday after I broke my hand. It was like 2 days after I broke my hand. The funny thing is, I could have told you that my hand was broken just by palpating the area. And the x-ray just confirmed that I had a fourth metacarpal fracture. But the thing is, I can't even tell you how much that x-ray cost me. It's been 3 weeks and I still don't know what they're going to charge me for that x-ray. This video is going to be specifically about one of the main things that keeps people poor in the United States, and that's healthcare. Statistically speaking, the United States has one of the worst healthcare systems in the world for developed countries. Out of the developed countries, we spend the most percentage of our GDP on healthcare, and that's 17%. What that essentially shows you is that we inefficiently spend money toward healthcare. Our life expectancy is anywhere between 3 to 6 years lower when compared to other developed countries. And lastly, the cost of treatment can be anywhere between 30 to twice as much more to all the way up to thousands of times more than other countries. Now I know what you're thinking, Adrian, why is it so expensive in the United States? And the main reason is, in the United States, our healthcare system is a for-profit system. It was seen as a good thing, and then private hospitals started to follow suit. And then everything became itemized, and now we have the foundation of a for-profit healthcare system. The result of a for-profit system is that competition is what drives innovation and the quality of care in the United States healthcare system. Now, that's not intrinsically a bad thing. Competition has led to shorter wait times in the United States compared to other developed countries. And without a question, the United States is the driving force behind the majority of innovation in both medical equipment and medical device fields. But that all comes at a cost. In other countries where there's universal health care, since everybody is under essentially the same insurance plan, which is sponsored by the government is allowed to set the prices that it's going to pay for care. And since so many people are a part of that healthcare system, the private companies that want to see those patients has to accept that price. Since they own the entire market share and they're able to set the price, it tends to drive the cost of healthcare down. Think about it like one large insurance company that has a monopoly or 100% of the market share. That insurance company would be able to set the price that they want to charge for their product because there's no competition. But the difference is a company in theory is going to maximize its profits. So if there is a monopoly, the prices tend to go up. Whereas the government is to maximize the quality of life of the people. So in theory, the prices under a government having a monopoly is that the prices would tend to go down. However, in both of these situations, since there's no competition, there's no incentive to innovate. So in theory, innovation would take a hit. That's one of the main reasons why you see medical device companies and medical equipment companies in the United States making better products, because they're competing against each other. To further explain, since healthcare in the United States costs more, companies can make more money in terms of revenue. And since the revenue is going up, the amount of money that goes into research will intrinsically go up as well. That research is what leads to innovations, and companies that don't innovate will get bought out by larger ones, or they will just lose market share and they have to disappear. So let me be clear, that innovation in healthcare is an objective benefit to the for-profit system in the United States. But the issue is healthcare is intrinsically a right. And what I mean by that is every individual is going to do what he or she can or can't do in order to stay alive. You can't have a life without maintaining the one that you have. You can't have liberty if you're trapped by the bills or your body. And you can't have justice if something that's not your fault, like cancer or a car wreck, completely ruins your life. To be clear, healthcare is not a right in the Constitution. It's not a constitutional right, and I'm not making the argument that it should be put into the Constitution. All I'm saying is there are clearly flaws in the United States healthcare system that we need to address. So to get back to my anecdotal example, I broke my hand on a Thursday. I didn't want to go to the doctor because I knew it was going to be expensive, but my girlfriend convinced me to go on that Saturday. I got an x-ray and a splint, and they told me my hand was broken to not move it. Something I knew and something I was doing already going into the urgent care. So I don't really see what they did for me. I could see if they wanted to take x-rays to see if they needed to reduce my fracture, but from what I could tell, there was only 2 people there and none of them were qualified to actually reduce a fracture in a patient. So no matter what I was doing, I was gonna go in there and get a temporary splint. Why even get the x-ray? I told you it was fractured to begin with. And by the way, I still don't know the cost of that visit, and it's been 3 weeks. I asked before I went there, when I got there, and they still haven't given me the bill for the visit. They couldn't even tell me how much it would be before they gave me the treatment. Nonetheless, that Monday, 2 days after getting those x-rays, I went to a specialist in order to get my hand checked out. Now, the specialist is a part of the same system of the urgent care that I went to, and they weren't able to bring up the x-rays that I took less than 48 hours before. So as a result of them not being able to pull up the x-rays, they made me take 3 more x-rays to get essentially the same picture. And once again, they didn't do anything to my hand. I'm not saying you had to touch my hand. If it didn't need to be reduced, it didn't need to be reduced. But it only took 3 minutes for the doctor to tell me that. I went downstairs, they made me this cast, and I asked how much the cast was going to be, and I couldn't get an answer. So keep in mind, I'm asking for the cost of the cast because I don't want to spend a lot of money on a fractured hand. I could have easily just bought a cast or a splint that does this essential thing from Walmart for $30. Here's a picture of one right here, and here's another picture. It's essentially the same thing. But the fact that I'm asking for the cost and I can't get a clear answer from the desk is mind-boggling. How can you not know the cost of a service that you're about to charge a patient? And keep in mind, I'm the one asking for the prices. If I didn't ask, they wouldn't even have been able to tell me that they didn't know the answer. What industry can you provide a service and a product and not give a quote of the cost of that service or product before you hand it over to the person? So fast forward, and I got a bill for $293 for that visit, $70 of it being for the x-ray that they had to retake because they couldn't get access to the x-rays I got taken less than 48 hours before. The doctor wants me to come back every 10 days in order to get an x-ray and make sure that my hand is healing. And I understand that, but that means every 10 days I have to go and pay $293 and $70 more for the x-rays that they're going to take over and over again, and the whole visit is going to take 5 minutes. How is 5 minutes of work worth $293 when we already know the hand is fractured? If I went back on the schedule that he wanted me to go back, since a typical hand takes 8 weeks to heal, it would cost me over $1,500 in just doctor visits. I was undoubtedly pissed at the price. That being said though, I do have an HSA and I do have insurance, but it's a deductibles insurance, which means I have to foot the bill up to $2,500, which is why I'm so upset. I can pay some of that with my HSA, but now I'm having to pay with out-of-pocket money. But here's the thing that I'm frustrated about. After I got the $293 bill, I called and asked them, is that all I owe you guys for the visit, for the x-ray, for speaking to the doctor, and for getting the cast made? And I got confirmation that that was in fact the case. The reason why I'm so on top of this is because I already have a medical bill in collections that my mother didn't pay when I was younger. So I don't want a second one in collections. After getting confirmation that the bill was only $293, I did go back for my first 10-day visit, paid another $200 for that visit. But I also requested the second cast. He wanted to put me in a different type of cast 3 weeks into it. So I requested to get it then so I didn't have to come back and pay another $200 for a visit. However, I woke up to a bill this morning for $305 for this cast. Now, I got that bill after I got billed initially for the initial visit, called and confirmed that's all I owed, and that's why I requested the second cast. But now I'm gonna have to pay $305 for this cast and for the second cast because they weren't clear on the cost of their service. And let me show you what that second cast is really quick. You see this? This is $305. That is $305. Why is this $305? Why is this $305? This is like 40 bucks. These Velcros is like, you could get probably a mile's worth for $5 from Lowe's. Why is it $305? So in sum total, I owe $293 for the first visit. I owe another $185 for the second visit. I owe $305 for the first cast, and now $305 for the second cast, and I still don't know the cost of the urgent care visit that I took before. All for a cast. That makes absolutely no sense. A fractured hand, which if I just ignored, shouldn't cost $1,000. Now, I have the money to pay for this. I have an emergency fund set aside for this. However, there are plenty of people out there with significantly more expensive medical bills, significantly worse insurance, and a significantly less income than what I have. There is absolutely no reason the cost of care is not clearly discussed with a patient before the care is given to the patient. I even asked for the price of the care because they weren't going to tell me, and when I asked, they still weren't able to tell me how much it was going to be. How does that even happen? That doesn't even make sense. Now, I'm not blaming the doctors or the employees for the urgent care group or for the hand specialist group. They're honestly really good people. I work in the medical field. They are some of the best people you will meet. That being said, I am blaming the United States healthcare system. Clarity of cost needs to be implemented without question in the care given. One of the main reasons why I would assume it's not typically talked about is because most of the stuff is overpriced. I mainly made this video just to bitch about my experience, so if you guys have a similar experience, good or bad, let me know in the comments below. Once again, I'm trying to hit 1,000 subscribers by the end of November. I think we can get there. So if you like this video, if you like these topics, go ahead and like and subscribe. I really appreciate it. And remember, it may be hard now, but it doesn't always have to be. I'll see you in the next one.